Distinguished ladies and gentlemen, it is a pleasure to be able to address you today and be a keynote speaker on the human right to water and sanitation. I thank the organizers, IWA, for having invited me to be present. However, since I had concurring commitments, namely the presentation of my annual reports to the Human Rights Council, I could unfortunately not be present in Busan today. Still I'm very happy for this opportunity to be able to engage with practitioners, service providers, whose participation, engagement in making the human rights to water and sanitation a reality is, in my opinion, crucial. As you know, in 2010, both the UN General Assembly and also the UN Human Rights Council recognized water and also sanitation as a fundamental human right, which is crucial for the enjoyment of the right to life and many other human rights. This declaration by the UN, or these declarations by the UN, were, in my opinion, crucial, but also only a first step. I see them as a promise to making sure that everyone gets access to sanitation, to water, and also to hygiene. So the resolutions of the UN Human Rights Council and of the General Assembly mean that water and also sanitation services have to comply with a certain number of criteria in order to make sure that they are in conformity with human rights. And what are these criteria? These criteria are, for example, availability, the criteria of availability, which determines that water and sanitation have to be sufficient for personal and domestic uses. So the number, the liters of water available per day have to be sufficient in order to making sure that people have enough resources for their personal and domestic uses, to drink, to cook, for their personal hygiene, for their domestic hygiene. Another important criterion is the criterion of quality. What does this mean? It means that the water cannot make us sick, cannot kill us. It should not pose a threat to human health. Facilities must be, namely sanitation facilities, must be hygienically and technically safe to use, and the water has to be available for hygiene, namely for cleansing, for hand washing, and also for menstrual hygiene management. Water and sanitation have to be physically accessible. They have to be accessible for everyone in the household or in its vicinity on a continuous basis, and the access to water and to sanitation cannot be a threat, cannot pose a threat to physical security. We all know that women, girls, for example, are often victims of violence, including sexual violence, on their way to fetching water, or when they are hiding behind a bush or somewhere in order to be able to exercise their right to sanitation. Furthermore, access to water and sanitation has to be affordable. It means it is more than talking about just a percentage of the household income that should not be higher. That should not be higher than X that is devoted to water and sanitation. It is about making sure that access to water and sanitation does not compromise the exercise of other essential needs guaranteed by other human rights, such as food or housing or healthcare. And I've seen on some of my country missions situations where people tell me, we have to choose between paying the pharmacy bill or paying the water bill. This is obviously unacceptable. I met with women telling me the water bills are killing us. They were killing them not necessarily because of the water they drank or the water they used for their personal hygiene, but in that particular case, it was a group of women I met in Windhoek in a poor area called Catutura. The women were telling me that the biggest amount of water they consumed was through sanitation, because they had waterborne sanitation, and that's that's where most of the money went to in terms of the water bill. And finally, there is another fundamental principle of cultural and social acceptability. What does it mean? It means that the sanitation solution that is found should be acceptable to people. For example, in schools, toilets should be sex segregated. For example, people should be able to have privacy when having access to the right to sanitation, but also when they have access to the right to water. I have visited communities, namely in, for example, Bangladesh. I visited a Dalit community. As you know, this is the lowest caste in the caste system. And these people, not only did they not have access to sanitation in conditions of hygiene and dignity. For example, the places they used to urinate and defecate had no roof, which meant that when the women went there, the boys climbed to the roof to look at them when they were naked and to stone them. But also in that same neighborhood, people didn't have any privacy when they were taking their showers or washing themselves. So they did it in front of everyone, anyone, for example, in front of me when I went to visit that neighborhood. And that obviously is contrary to the concept and to the principle, of cultural acceptability. There are furthermore some cross-cutting principles, some cross-cutting human rights principles that should infiltrate, permeate any decisions, any measures, any policies taken in the area of water and sanitation. One of the fundamental principles is obviously non-discrimination. Non-discrimination, reduction of inequalities, sometimes it is also called equity, even though in legal terms it has a different meaning. But I would then say the principle of non-discrimination, or the obligation to reduce inequalities, to reduce the gaps between those who have and those who don't have access to water and sanitation. And as we know, the reasons why people have and have not are different. They are based on income very often. So the lowest wealth quintiles very often are those who have less access to safe water and sanitation. But in my opinion, and in what I've seen on the ground, money doesn't tell us the whole story. What do I mean? I mean that a wealth quintile analysis is not enough in order to explain us the reasons why some people are deprived of access to water and sanitation. Let me give you an example. I went to Slovenia on country mission, and as you know, Slovenia is a EU member state. It's not a poor country. Everyone has access to water and sanitation, everyone except a minority in the country, which is composed of the Roma. I visited some Roma settlements, and people are not connected to water nor to the sewage because they live in so-called illegal, informal settlements. Now, if you ask me, would these people have the money to pay for a water and a sewage bill at the end of the month? I would say yes. I've seen that these people very often had mobile phones, they had TV, satellite dishes, etc., which makes me believe they would have money to pay for the water bill. So lack of resources or availability of resources does not tell us the whole story, because the whole story in that case is that this is a group which is stigmatized, which is excluded, and which has not been at the center of policy making, decision making, even budgetary allocations when it comes to investments in the area of water and sanitation. I have to say, and this is a parenthesis to this intervention, that following my mission to Slovenia and following my recommendations, the government has started to adopt very concrete measures to making sure that the populations I visited started getting access to water and sanitation, which means they started to not be discriminated again anymore. Another issue I wanted to mention is the 2006 UNDP report, which very eloquently says that scarcity of water is manufactured through political processes and institutions that disadvantage the poor. So what I mean to say is that lack of access is not an accident. It is the result of decisions that are taken or that decision makers fail to take in order to prioritize and to address these groups. Finally, I want to mention participation, the importance of participation, active, free and meaningful participation, which goes beyond a mere consultation and information, but rather gives a genuine opportunity to express demands for people, to express demands and concerns and influence decisions. Participation must include all individuals and groups that are concerned. It must ensure transparency, access to information, and obviously it requires capacity building and also training. And finally, accountability, which is an inherent feature of human rights, which looks at the relationship between the state, which is obviously, as you know, a duty bearer, and individuals, which are rights holders. The importance of the concept of accountability is that it means that individuals are no longer, or providing water and sanitation to individuals is not longer an option. It's not a question of benevolence. It's not a question of charity or welfare, but it's rather a legal entitlement, and people have legal claims that they can make in order to get access to water and sanitation. So the concept of accountability in relation to human rights gives or contains a significant potential for empowerment of people. Does this mean that human rights have to be, the rights to water and sanitation have to be realized overnight? No, that's not what it means. It means that states have the obligation to take steps to progressively realize these rights and to making sure that people will progressively get access to these rights. Does it also mean that the state has to give water for free, provide water and sanitation services for everyone? No, that's not what it means. Those who have the resources, they should and must pay for access to water and sanitation. What the right means is that those people who, for reasons beyond their control, cannot have access to this right, they should be helped. They must be helped by the state through mechanisms as cross-subsidies, social tariffs, different modalities, which make sure that these people are not deprived just because, for reasons beyond their control, they cannot have access to water and sanitation. I think this presentation was rather short. I would have many more things to say, but I hope that this helped to elucidate and to clarify some questions regarding the human rights to water and sanitation. I have a website, and I prepared a compilation of good practices in relation to access to water and sanitation. The compilation is contained on my website. The website is www.ohchr.org/SR water and sanitation, and there you will find much more information regarding my work and my mandate. My email is there, and I very much welcome any interaction with you. Thank you very much for your attention.